welcome back, and thank you for your patience and waiting for us as we learn more about cervical cancer, we have learned about the cause, we have learned about the symptoms, and we are yet to learn about how it could be stopped or how it could be managed. Now, before we proceed to the next questions and to the next information, I would like to remind you, do you have that space and you don't know how to deal with it, you don't know how to decorate it? That is why we have DreamWorks Investment Limited Company give you the very best in detail. So don't hesitate, just make a call, it's on our screen, and they will reach out immediately. So now heading back to the question.
Yes.
We were talking about the screening session.
Yeah.
What happens immediately you realize there's an abnormality in an individual after screening?
It depends with how much of the abnormality that has been detected.
Mm-hmm.
But if it is the normal changes or what we call hyperplastic changes,
Mm-hmm.
There's what we call destroying those cells. So they can be destroyed by what we call cryotherapy or applying very cold substances to the cervix to kill those abnormal cells or the cells that are turning into cancer.
Okay.
Or they can be dermoabrasion or killing these cells using heat energy to destroy those cells. And then now there's surgery where you can get rid of those abnormal cells. Yeah, and then now if it is the abnormality has been found to be cancer, then it is treated appropriately.
Okay. I was thinking of checking on the vaccine, but before we talk about the HPV vaccine or any other vaccine, are there stages
of the
cervical cancer?
Yes, there's stages. There's what we call carcinoma in situ, or before the cancer is fully formed. We can call it stage 0. Then there's stage 1 to stage 4, depending on how big the cancer is or the area that is affected is, and how far those abnormal cells are spread. So are they just localized to the cervix? Have they gone to the uterus? Have they gone to the other part of the reproductive system? Or have they gone to the nodes or what we call ngai? Or have they gone to distant places?
Okay.
Yeah.
So we have touched a little bit on how to tackle with the cancer after you find out how it happens, or it's there, it's existing. Where does HPV apply, or what does it actually do?
The HPV or the human papilloma virus causes 99% of the cancers. So now when we target vaccination, we are preventing this HPV virus,
okay,
which now is the cause of the cervical cancer, among other cancer. It's not that it only causes the cervical cancer, it can cause other types of cancer. But now, because we are speaking about cervical cancer, when we target the HPV vaccination, we are preventing over 75% of the cancers. Yes, because mostly what we target on vaccination, because we say there are over 100 types of HPV viruses, some of which are high-risk cancerous, others are not. So two types of HPV HPV viruses are what that are targeted by most of the vaccines that we give.
Okay.
That is why even if a person have had the HPV vaccination, it is still important to have the screening, because we have just targeted two, which are notorious, that will prevent over 75%. But remember, there is this another percent, the small percentage that is not targeted by the vaccine.
Okay, so how effective are the treatment options for the cervical cancer?
When received early, or when the cancer is seen early, or even before the full cancer is formed, it is curable, completely curable, and a person lives a normal life.
Okay.
So yeah, depending on the stage and depending on the treatment options. So unless it is really advanced cervical cancer, treatment options are really they are really effective. Yes.
So naturally human beings are very ignorant.
Yes.
So if maybe one anaona sio risk, it's not such a big risk if I could live, how bad could it get if left untreated?
If left untreated, or if it has gone beyond beyond where the surgery can be done and maybe radiotherapy can be done, the only thing that can be done is the chemotherapy, which most of the time, if it is advanced, it will not completely cure the cancer. What it will do, it will minimize the spread of the cancer or control its spread. So even though we are saying that the treatment are effective, they are only effective if the cancer is gotten early.
Detected early.
Yes.
Speaking of which, can it cause infertility at any cost?
The cervical cancer?
Yeah.
The cervical cancer on itself cannot cause. However, the treatment options and maybe the advancement of the cancer, if it affects the uterus, can cause the infertility. So the treatment option, one of the treatment options of cervical cancer, and the best actually, is surgery.
Okay.
And what they do in surgery, they will remove, including the womb.
Oh.
So now if the womb is removed, then the infertility comes in. Then again, other options like radiotherapy and chemotherapy, again, they will, they have the chances of causing infertility.
Wow. So how do you manage the women who have been diagnosed with cervical cancer, or what do you give advice? What advice do you give to them?
Okay, depending on the stage, during the first stages, we do surgery.
Okay.
Where the affected area is completely removed. The other thing is you can do what you call concurrent chemotherapy and radiotherapy, where you get weekly chemotherapy as you get radiotherapy. Radiotherapy is basically, it looks like a CT scan machine. I know most of people have seen a CT scan machine, where the rays, it's actually the rays similar to those of the X-rays that burns or destroy the cancer cells. And then now, if it is advanced where it's not possible to do radiotherapy, now you get only the chemotherapy.
There's this part where, let's say an example, when it comes to maybe HIV and AIDS, we have post and pre advice. How do you handle now the emotional state of women?
What we do, and in cancer, it's mostly a multidisciplinary approach, where you don't just tell somebody that you have cancer. You need to know whether they are ready to get the news.
Especially because it's a killer disease.
Yes, and people fear it. So we have counselors, we have social workers, we have nurses who are trained to break the news and handle the patient, and also the relatives and the caretakers of the patient.
Oh, okay. Now, what support resources are available for women diagnosed with cervical cancer around within our community currently?
What maybe I can say is SHA. Even though there are challenges, at least it is able to cater for the diagnostics as well as the treatment, the treatment of the cervical cancer. And again, our facilities which are available, like Embu Level 5 Hospital is also a resource enough for our patients.
So there's a season where I saw that the health workers are encouraging the screening so much that they are going in communities, in schools, encouraging and giving free screening. Does it still happen?
Yeah, it still happens. Like currently, in the next like 2 weeks, we will be having a free cervical cancer screening just to mark the Cervical Cancer Awareness Month. That will take place in 2 days and it will be free. It will be next week, that one, I think Tuesday and Wednesday.
At Embu Level 5?
Yes, at Embu Level 5.
Okay.
And even beyond that, we usually do continuous screening at the MCH. And also there's another clinic for cervical cancer. So it is usually continuous in our facility. Yes. Yes.
That is amazing. So can you give maybe a conclusion remark on this? And mainly, please remind them that it's curable.
Yes. It's curable, especially when found early. So the best way out is screening.
Okay.
And we say screening from the age of 25 to the age of 65. You should be getting screening at least every 3 years if your previous screen was clear. Yes.
So that is amazing. So if anyone maybe needs more information or to get to you, maybe learn about themselves, or they're having some symptoms back at home, how can they get to you?
They can visit me at Embu Level 5 Hospital. I am in the oncology unit. Again, you can visit our MCH, where we also have a clinic for the same. And we also have another clinic for the same, again, in the hospital. So if you just come to the Level 5 Hospital and say what you want, you will be directed to the appropriate places, and we are ready to help.
Wow, thank you very much, and thank you for the show. I have learned a lot, and I hope my viewer back at home or wherever you are, you have learned a lot. Again, this is not just for the women. Also understand your woman. We are on the next season, it's Valentine's. Make sure your woman is healthy, take them for a screening, and take care of their health. So thank you for the show. This is the Health Hub again. I am Nyambura Kamau, and I will still remind you, make the right choice when it comes to building, investing. Do you need those rentals, and do you need them built in a very fashionable way? All you need is to call Dreamworks Investment, and they will give you the very best. So until next time, I am Nyambura Kamau.